Can I get a sound check from that end, please?
Yep, we hear you loud and clear.
Perfect, I can hear you too, thanks. We're live.
Wait for it. I'm sorry.
Mayor, we still have a couple of commissioners that we're waiting on.
All right, good afternoon. Before I call the meeting to order, give me one moment. Thank you. Before I call the meeting to order, I want to announce that due to COVID-19, we have individuals attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. During the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and is current guidance from the Kansas Attorney General. I'll call the meeting to order and ask the clerk to announce the meeting and call the roll.
Thank you, Mayor. Good evening. You are hereby notified that I have called a special session of the Unified Government of Wyandotte County in Kansas City, Kansas, to be conducted virtually on Thursday, September 9th, 2021 at 6 p.m. for a COVID update. Roll call. Ramirez has submitted an absence. Commissioner Johnson.
Here.
Kane.
Here.
Markley.
Here.
Walters.
Here.
Philbrook. Commissioner Philbrook. Commissioner Bynum.
Here.
Burrough.
Here.
Townsend.
Here.
McKiernan.
Here.
Commissioner Philbrook, one more time. I see her there, I just don't hear her. Mayor Alvey.
Here. Thank you. All right, so tonight for the special session, we have a COVID update. I'll turn it over to Mr. Bach.
Thank you, Mayor. Doug Bach, County Administrator. As we've gone through the last couple of years with the pandemic, we routinely will come back before the commission and provide you an update of activities going on. Later this evening, we do have considerations on the formal agenda regarding the emergency order, which is in place mainly for our reimbursements we get through FEMA, and then also consideration of extending the mask order. So we thought it would be very timely tonight to have the team come forward and give you an update as to where things are in the community and the impacts on others. So I will recognize Dr. Aaron Corvo, who's our Deputy Medical Officer, to begin the presentation this evening. Dr. Corvo?
Thank you, Doug. Let me try and share my screen here with you all. All right. Thank you all for joining us this evening, Mayor, Commissioners, members of the public who may be watching. Unfortunately, Julianne Van Loo is out of town this week. It's given us a grand appreciation of all that she does. And so Dr. Greiner and myself and other staff are trying to hold down the fort. And so I believe Dr. Greiner may be jumping on and joining us for part of this presentation as well. This evening, we're just going to have a brief update for you all. We'll cover the COVID-19 situation as it stands right now. We would like to bring forth another recommendation to be considered by our commission as well this evening later at the 7 o'clock session. Covering sort of the normal numbers that we look at here, our 7-day rolling average happily is starting to trend down. And so we see that our average at this point is 63 cases a day. You can see here that we had a huge peak there in this recent surge late this last month. There may be a slight data lag given the closure for Labor Day, but it does look like we may have turned the corner in number of cases that we're seeing in our community. So that's really good. All told, during the pandemic, we've had over 23,000 confirmed cases of COVID. We're now at 340 deaths in our community, and unfortunately, 4 new deaths just in the last week. Just in the last week alone, we also had 421 new cases. The health department still is engaged in a very robust testing program. We're testing on average approximately 300 people a day. And in our community in general, doctor's offices, KU Medical Center, Providence, et cetera, we're doing about 800 tests per day. And so we think that that's pretty robust for a county our size, which is great. Our positivity rate at the moment is just under 20%, which is looking better. We were up above 30%, I believe, the last time we presented to you all. So we feel like that's a good thing. As far as our vaccination data, you can see here that unfortunately the majority of our residents in Wyandotte County still remain unvaccinated. The numbers that I'm showing you here are percentages based on the entire community. So those who are eligible for vaccination, that is above the age of 12, and also those who are younger than 12. So all told, it looks as though just over 40% of our community has completed the vaccination series. That's 2 of the Pfizer, or 2 of the Moderna, or 1 of the Johnson & Johnson vaccinations. And then it looks as though just above 47% have initiated at least one dose, their first dose. So we feel like that's coming along, and we hope that they complete their series. Of course, we're still unable to get our data from Missouri, but these data, or anyone in Wyandotte County who's been vaccinated within the state of Kansas, we do have those data. I want to show you something new and really pretty kind of cool and unique that's come out of our state health department. They're now putting out county COVID rankings. And I just want to share with you some good news out of our county. If you look on the left-hand side, you see the counties there. And if you scroll all the way down, you see our county there, Wyandotte. And then if you follow Wyandotte all the way toward the right, under the column labeled rank, you see that our county ranks 9th in the state overall in our COVID ranking. Now, this ranking is comprised of 3 measures. That is our vaccination rate, the number of COVID cases that we're seeing in our community, and also the number of tests that we're doing as a community. And so you can see there under vaccination rate, we're 16th in the state, and it lists here 54%. Now we'll remember that KDHE takes into account those who are eligible for vaccination, so those above the age of 12, which is why that number looks higher than what I presented in the previous slide. So we're doing okay there. As far as our COVID-19 testing then, over in the blue column, we see that we're doing pretty well as well. We're 10th in the state. But when we look under cases here, we see that we're labeled 61st. So I think to myself, man, we're still seeing a lot of COVID cases in our community. We know that there's still community spread of this Delta variant within our community. And so that's really where we're focusing our efforts. Again, we've got to stop the spread of this virus. Now, you'll remember that we currently have a Wyandotte mask resolution or mandate that's in place currently that is in effect for Kansas City, Kansas, and excludes Bonner and Edwardsville. And that went into effect on August 5th and is set to expire on September 16th. If Dr. Greiner is on, I'm going to turn it over to him. Could somebody help me to know if he is on the call? I do not see him, so I'm going to go ahead and continue with the presentation. Sorry about that. So just to give you all an update of what we're seeing in surrounding communities for mask mandates. And requirements. In Kansas City, Missouri, mask mandate is for indoors and public spaces, including in schools. Their mandate was extended through September 23rd. You can see there for Jackson County, we have indoor and public spaces as well. Masks are required, extended through October 7th. In our neighbor, Johnson County, we see that masks are required in school settings, kindergarten through 6th grade, and that is going to be instated for the remainder of the school year through May of 2022. Leavenworth, Kansas has not adopted a mask mandate. Now, we're considering a lot of things when we bring forth this recommendation to you all this evening. Our primary considerations are as follows. You know, we're still experiencing high uncontrolled community spread as defined by the CDC. You can see on the map here, which is updated, we're still sort of in that red zone. The Delta variant, as we've talked about previously, is much more transmissible than previous strains of COVID. Last month and this month, still 100% of the cases that have been sequenced by KDHE have come back as the Delta variant. We haven't seen any new variants at this point in time. We're still dealing with this sort of tail end of this big Delta surge. Unfortunately, you know, again, just over 40% of our county residents are vaccinated, which means the majority are not. Many children, of course, under 12, ineligible for vaccinations. We expect there to be an update in the fall regarding that. And then I do want to talk a minute about our hospital resources remaining at a very sort of strained situation. At KU Hospital, where I practice, we're still not seeing any decline in the numbers of patients who we have on ventilators or in the hospital with COVID at this time. We still have day in and day out over 100 patients of our total 900 patients inpatient who have COVID-19. Now we're seeing that these hospitalizations are still in our younger population, unfortunately, 30s, 40s, 50s. We're also seeing many children still at this point in time hospitalized, which has been very sad. What we would like to recommend for your consideration this evening is that our mask mandate be extended. We would like to recommend that the current resolution be extended in its current form, that is KCK, with the exception then of Bonner and Edwardsville and the schools, be extended. We're recommending an additional extension of 8 weeks. That would be set to expire then on November 11th. And we're recommending that based mostly on what we talked about this evening, but our hospitals, we really need to take them into consideration, the exhaustion of our nurses and of our resources for our healthcare workers. We're recommending just the same, that we should mask up in public indoor spaces for both vaccinated and unvaccinated individuals. And we're recommending for the age of 5 and over. So again, the same resolution, just extended 8 weeks. That concludes my presentation this evening. I'm happy to take questions. I'm going to stop sharing for now and can bring up the presentation if necessary in another minute or two. Thanks.
If you can return, I cannot access the the gallery. Aaron,
Mayor, I believe I've stopped sharing.
okay, I cannot access the gallery.
Mayor, I believe Ms. Bonachin has something she would like to add.
Okay, can I get the gallery restored? How is that not happening?
I think that's on your individual screen, sir.
Okay. I don't know what I did. All right, yes, Mrs. Bonachin. There we go.
No, I didn't have anything to add. I'm so sorry. I accidentally hit the hand button.
Okay, thank you. Commissioner Bynum.
Thanks, Mayor. I have a couple of questions and a comment. My first question is, Dr. Corvo, thanks for the presentation. I see that within our 7 o'clock meeting, our request is to continue our mask mandate through November. And I'm curious, from the health department's perspective, what numbers or conditions in the community would be appropriate for us to be able to say we don't need a mandate? That's question number one. Question number two might be more toward legal counsel, because I know within our mask mandate local health order, I've had some people ask me about the penalty part of that. And it's my understanding that that penalty has existed in all of the health orders. And I'm curious, the penalty that's listed, have we ever actually enforced that penalty? So those are my two questions. And my comment is this: in looking at the COVID hub, I've been specifically looking at the data, the 2-week look back of cases in folks age 39 or younger. And I think I'm seeing this week, as of yesterday's numbers, a pretty significant decrease in that, which makes me really happy, because last week that number was 675 cases among, just in the past 2 weeks prior, among 39 and younger. And I thought that was a rather devastating number. And this week, I think that number is down to something like 520 something. So that certainly looked to me like we were definitely making improvement in that 0 to age 39 category. So that's the comment. But first question, Dr. Corvo, was just what would you all think is a satisfactory set of conditions to not have a mandate? Thanks.
Thanks, Commissioner Bynum. It's a really good question. Of course, we've never had any, hard and fast sort of landmarks. We've been sort of rolling with the punches, so to speak. I would like to see our percent positivity rate decrease and the number of cases that we're seeing on a daily basis go down. Again, we're seeing over 60 cases a day. And I would love to see that, 20 or less would be great. I would love to see our percent positivity fall below 10%. That would be ideal. And I'm talking about sort of how we're thinking through this with sort of CDC in my mind. I'm also, just to be honest, worried about flu season coming up. We should all be starting to get our flu shots, beginning of October. We're a little bit worried of having sort of cases on top of cases, if that makes sense, the COVID cases and the flu cases. I would also like to see some space also in the hospital open up. I believe that if we were to not require masks, we've seen a really impressive downturn of those cases. I think we've kind of turned that corner, as you point out, which I think is right. And I think that is due to masking, But I think if we were to let up too soon, we could have another sort of bump. I don't think our healthcare workforce in our hospitals could take that right now. So those are the things that I'm thinking about. I'll turn it back to you or to Misty, I believe, and James, our legal counsel, to answer your second question.
Thanks, Dr. Corvo. James Bain, Unified Government Legal Department. Commissioner Bynum, to answer the question about the penalty and the criminal enforcement, back before COVID was even a thought, there was a state statute that made violating a local health order a crime, Class C misdemeanor. When we started getting into having to actually have health orders in a COVID world, the decision was made and ordinance passed to have a city or a county ordinance also making the violation of a local health order a crime. And so that's kind of where that came from in March of last year. And so that has been in all of the orders since then, that it, in addition to the state law, it was also could be prosecuted in our municipal court as a city ordinance violation. We have not had any convictions, no tickets written, nobody's been brought to court. The police department has had an education focus on all of the health orders, going back to gathering limits, things like that, and now masks. And so there has been no criminal prosecution.
Thank you.
Okay, seeing no other hands, thank you for your presentation. We do have a couple of items during the regular session, but for now, that concludes our special session. We are adjourned, and we will reconvene at 7 p.m. for regular full commission meeting.